So as a recap on our athletic training as a profession unit, let's kind of just run through the basics. First of all, we start talking about the sports medicine field and who's in that field and what that even means. Remember, anybody that is associated with sports medicine has one goal, and that's to help the injured athlete or injured individual get back to healthy status, back to return to play, back to living a normal life, all right? And there's many different professions in this group of the sports medicine team that help each other help that patient, all right? And we've talked about a few of those professions very briefly. There are tons and tons of different ones, okay? We also talk about the sports medicine team and how it's broken down into the central and peripheral groups. Okay, remember that the central groups are going to be mainly the professionals who have that daily contact with an athlete. So when we see on our list, we see the athlete as the center of the sports medicine team, because without an injured athlete, we don't need a sports medicine team. We see the parent if they are a minor. We see the team physician if they are working with that specific team. You have a little bit more access to them as opposed to their primary physician. You see the athletic trainers, and you also see the coaches. All right. In the peripheral branch, we see your primary care physicians who you go to for any number of injuries, our student athletic trainers, anybody that has that IST, the specialist, like a physical therapist, the podiatrist, remember, that works with the feet, allergist, dentist, neurologist, any of those, okay? Because you're not going to see those guys on a regular basis. All right. Then we start talking very briefly about the different professions, okay? Remember, we see nurses. Nurses are the RN, that's a registered nurse, okay? We talked a little bit about physical therapists, who are going to be the ones helping with rehab, whether it's after surgery or just after being seen by a doctor. They help to get the patients back to their normal activities. We see a physician's assistant who helps assist a doctor with procedures. They see patients. They are typically grouped by different specialties like orthopedics, like working with children. And we see a dentist. We talked yesterday in class a little bit about seeing a mouth trauma in sports and how it is more beneficial to have a team physician. A team dentist. We have our medical doctors, okay, that have very different specialties. My example here is the ear, nose, and throat doctor. You're going to have somebody that's a little bit more qualified to deal with some type of injury in that department as opposed to just a regular general physician. All right. After we talked about the professions, we also talked a little bit about the athletic training program, the steps that are associated with athletic training, dates to remember. I told you guys the American Medical Association was established in 1991. They recognized the athletic training program as a healthcare education program, meaning that they saw what we were doing and decided that it fit alongside with the medical field. Okay, and in 1950 is when the NATA first established the governing body of athletic trainers. Different roles for athletic trainers are very similar to others that are in the sports medicine field. Injury prevention, recognizing and evaluation of injuries, rehabilitation of injuries, and healthcare administration, dealing with paperwork and that kind of stuff. We do have 4 different types of credentials for an athletic trainer. You have your licensure in the state of Texas. Certification is the national certification. And then you also have registration and exemption. Okay, remember, registration and exemption are not as common as the licensure and certification. Okay, the different domains and different areas of study for athletic trainers are just different areas that somebody in the sports medicine field has to take classes in. They have to become proficient in. So a couple ones that we talked about yesterday, biomechanics. Remember, biomechanics is dealing with how the body moves. Okay, we talked about pharmacology, dealing with meds, pharmaceuticals, and how to become an athletic trainer. The Commission of Accreditation of Allied Health Education Programs, CAHEP, they're the organization that is used to help evaluate college programs, and they look at everything and figure out if that program is up to the level that it should be for it to be given that accredited status, which helps their students sit for those national exams, which everybody is trying to get to. That's the main goal. And the very last thing that we talked about was the traditional settings versus non-traditional settings, okay, for athletic trainers. A traditional setting typically has been considered a school environment, like me working in a high school, working at a college, or working with some type of professional team or other kind of athletic team that hires out an athletic trainer. A non-traditional setting is considered somebody that works more in a clinic, whether that's a rehab clinic, whether that is a fitness center and health club. We also see different industrial sites. I mentioned yesterday in class about the Army. We also have some big Fortune 500 companies that hire athletic trainers to run their fitness center for their company. Okay, that was just the basics of Intro to Athletic Training. We will progress to our next chapter, which is over anatomy.